Hello, this is Taekyun Kim. Today I'd like to talk about why it is so difficult to treat post Lyme disease syndrome. Lyme disease is a bacterial infection by Borrelia. It can be best treated in early stage. Treatment for early localized disease is a simple 10 to 14 day course of oral antibiotics to eliminate the infection. It normally takes 28 days to 3 months to get rid of the infection. If people are treated for Lyme disease with antibiotics but continue to experience the symptoms, it is referred to as post Lyme disease syndrome or post-treatment Lyme disease syndrome. About 10 to 20% of people with Lyme disease experience this syndrome, but doctors and scientists still do not clearly know why. In my personal opinion, I believe that the post-Lyme disease syndrome is like a multi-systemic disorder. The function of all our body systems go down to almost the bottom level. Among all the body systems, we need to keep an eye on the three specific important systems of our body. The first one is a digestive system, the second one is an endocrine system, and the last one is an immune system. From the digestive system, we receive enough nutrition every day to produce necessary amount of energy for our daily life. If our digestive system is not working properly, we cannot produce enough energy for our daily life. Our body endocrine system produces many different kinds of hormones and controls the metabolism of our body. The term metabolism is commonly used to refer specifically to the breakdown of food and its transformation into energy. When these two systems do not work well, our body starts to suffer from energy deficiency. This is why all the people who have post-Lyme disease syndrome feel always tired. Not just get tired, but they cannot deal with their daily life. If our body does not have enough nutritional support for many period of time, this can affect the blood level of our body. Therefore, many of the people who have post-Lyme disease syndrome are quite anemic, or although they are not anemic, they share many symptoms such as fatigue, dizziness, cold hands and feet, chest pain, shortness of breath, etc. because of the low level of blood. Thyroid gland and adrenal gland are two most important glands in our body's glandular system because they are kind of 1-2 punches to maintain the metabolism rate of our body. Almost all the people who suffer from post-Lyme disease syndrome shows that they normally have weak glandular system, especially thyroid and adrenal glands. By these kinds of facts, it looks quite natural for the people who experience post-Lyme disease syndrome for a long time cannot deal with their daily life because of severe fatigue. Our immune system gets massively shocked by the infection from the Lyme disease causing bacteria at first. Then it gets weaker and weaker because of the poor supply of nutrition and blood as time goes by. In addition to these three body systems, many other systems are connected directly and indirectly. That's why it is so difficult to improve the symptoms of post-Lyme disease syndrome. Still, lots of people who have post-Lyme disease syndrome keep searching the quick fixing method here and there. They are using a lot of money and making huge effort and even using a lot of energy to find out the way for the fast recovery. I fully and truly understand how much desperate they are, but people who suffer from post Lyme disease syndrome need to be patient and accept the fact that it might be a long journey. According to my personal experience, it normally takes 3 to 6 years time on average for the people who suffer from the post Lyme disease syndrome to come back to their previous normal life. Quite often, I can see that many of the doctors and even lots of complementary medicine practitioners try to access this post Lyme disease syndrome, which is kind of multi-systemic disorder, with 1 or 2 simple methods. This does not seem to be a very effective approach because many of our body systems are involved at the same time in this case. We 8 constitutional therapists divide all the human beings into 8 different body types according to their dynamic orders among our body internal organs. There are 12 internal organs. These are heart, lung, pancreas, liver, kidney, small intestine, large intestine, stomach, urinary bladder, gallbladder, sympathetic nerve, and parasympathetic nerve of our autonomic nervous system. The 8 dynamic orders of those 12 internal organs physically, mentally, and emotionally differentiate 8 distinctive individualities. We 8 constitutional therapists believe that all the human beings are born with their own specific body type. And this means that each of us has its own 12 internal organs dynamics. This dynamics is called an original balance. When we lose this original balance, then we can start to experience any disease or any symptoms. This original balance can be disturbed by bad lifestyles, such as smoking, drug taking, eating wrong diet, going to bed too late, and so on. It also can be broken by mental, emotional issues or trauma, such as addictions, divorce, partnerships, family issue, many kinds of childhood abuse, etc. All the people who suffer from the post Lyme disease syndrome are very fragile, physically, mentally, emotionally. Therefore, I strongly believe that regaining our body's original balance can be the fundamental way to deal with not only the post Lyme disease syndrome, but any other disease or symptoms. Thanks for watching this video.